Hello, everybody. Welcome to the Natural Food Pantry Education Initiative. Returning today to discuss one of my very favorite topics, digestion, is Dr. Kate Rheaume, Naturopathic Doctor. Dr. Kate Rheaume is a graduate and former faculty member of the Canadian College of Naturopathic Medicine. As a very reputable educator, Dr. Kate speaks internationally on many topics related to health and wellness. She is the author of the best-selling book, Vitamin K2 and the Calcium Paradox: How a Little Known Vitamin Could Save Your Life. Welcome back, Dr. Kate. It's always so wonderful to have you with us at Natural Food Pantry.
Thanks, Natasha. Great to be back. Nice to see you again.
Nice to see you too. So let's dive into our conversation on digestion. This is going to be a fun one. Digestion, it really is such a complex process. I think it's something that a lot of people don't put a whole lot of thought into. We tend to eat a meal. We're often eating when we're rushed, we're on the go, we're between meetings, and we don't put a whole lot of thought into what happens to our food. It's a process that takes a lot of energy, and it's a process that is linked with so many other areas of our health. So do you have any, with it being so important, with digestion being such an important factor to our health, do you have any suggestions for people on how to improve and support overall digestion?
Definitely. It's funny, as you were saying that, the quote from Mark Twain popped into my head, which is, "To eat is human, to digest is divine." And I think that speaks to the fact that it's easy to eat, but then what happens after that, can go sideways and doesn't always go smoothly. But there are definitely simple things that we can do to improve our digestion, and it can make a surprising difference. I think we will sometimes take digestion for granted, but as simple as it sounds, just slowing down, taking time, even if it's just a snack, to sit down and eat it. I haven't seen any studies on this, but I'm convinced that you don't secrete digestive enzymes as efficiently when you're standing up, for example, or when you're driving. That little extra bit of stress may be enough to impair the digestive process. So taking time to, at the very least, sit and have your snack or meal, and hopefully be able to do that in ideally a relaxed setting, or having a little bit of time, and not be rushed while eating, because that will impair. It's the opposite. Fight or flight is the opposite of rest and digest, and it just sends messages to the digestive tract that are not conducive to good digestion. So relaxing is really important when it comes to eating. That's one I can think of. And what goes along with that is chewing. Again, this seems obvious, but so many of us don't. And the digestive process starts in the mouth. There's a mechanical digestion, of course, but there are enzymes that are secreted in the mouth. And I've seen some research to suggest that by mixing your food with saliva, there's a certain amount of molecular labeling that goes on to help send messages once the food gets down to the stomach and beyond of how this food should be sorted. And so that just speaks to the importance of chewing, more than 2 or 3 times before you swallow. So those are 2 simple tips that I think are often overlooked, just slowing down, taking time to chew.
That makes total sense. When we're in that state of fight or flight, digestion isn't top priority, right? So slowing down, taking a breath, mindful eating practices, I think make a huge difference. And chewing. So how much do you recommend that people chew? I've heard some practitioners say, chew every bite 120 times.
I've heard that, things like that too. And that, from a practical standpoint, maybe we don't have enough time for that.
Right.
But I would say ideally 20 to 30 times would be nice. But, whatever it is that you're doing, I happen to chew a lot because my dad growing up was always telling me, chew your food, chew your food. So I'm a slow eater and I chew a lot naturally, or it was drilled into me. But just, count your chews and try to add a few is probably a good goal. Just increase whatever you are doing right now. But, 20 to 30, I think, would be great, depending, of course, what you're eating.
That's a good idea. I like that. Count your chews and add a few. And I guess it depends on the type of food too. Some foods can be chewed more than others.
Right.
And moving on to digestive symptoms. So there's so many digestive symptoms that people suffer with. And because digestion is connected to every aspect of our health, other symptoms in the body can also be tied back to digestion. But just thinking about customers here at Natural Food Pantry, I would say that the most common three complaints that we get around digestion are a topic that not a lot of people like to talk about: constipation and irregular bowel movements. That would be one. And then acid reflux would be a second. And the third would definitely be bloating. We get a lot of people commenting that they experience general bloating, particularly after meals. So, what do you have any specific recommendations geared to those three complaints?
Mm-hmm. Well, we can look at this from two sides: is what is triggering those symptoms and what can we do to relieve them. Often what's triggering those symptoms are the foods that we're eating. And so do we have a sensitivity to something that we're eating that's triggering those symptoms? And that can be, in a way, it can be almost anything, but there are certain foods that are very common culprits that will produce either constipation or irregular bowel movements, acid reflux, and or bloating. And so identifying those and eliminating them can be a very effective way of dealing with those symptoms. For those particular ones, it's not a popular recommendation. This is rarely well received, but unfortunately, wheat can be a real trigger for people for all of those problems. And it's really worthwhile, and it can be really eye-opening to try a trial, maybe 30 days, for example, giving up wheat, which when you start to think about it, for a lot of people, this is something they probably are eating at almost every meal. So not necessarily easy, but looking for those substitutes and trying to go wheat-free for a month, and it can be really surprising the difference that it can make for a lot of people.
Wheat specifically, or gluten in general?
Ideally, so initially it may be gluten in general, but for whatever reason, I find that wheat, even though there are other gluten-containing grains, for whatever reason, wheat tends to be more problematic. And there's, lots of reasons that could be that I won't necessarily get into. And so, people will, and it may be simpler to go gluten-free for 30 days and then reintroduce certain foods, but I find wheat tends to be the trigger for acid reflux, for bloating, for constipation. It can trigger all of those problems.
Yeah, and customers are certainly in the right place to explore that avenue because, Natural Food Pantry has all kinds of wonderful alternatives to wheat and gluten, and we always have a nutritionist on staff as well. So there are people here that can help people who are considering, doing that trial.
Mm-hmm. Now that's a sort of a big solution, and for most people, or for a lot of people, that will treat the underlying cause of their symptoms.
Yeah.
That said, we know we're going to the holiday season. There are plenty of traditional annual treats that contain wheat that people don't want to pass up on right now. I get that. So there are a lot of natural solutions that will help relieve those symptoms. Making sure we're getting adequate amounts of fiber can help promote bowel regularity to avoid constipation or irregular bowel movements is one, certainly. In terms of acid reflux, DGL, which stands for deglycerated licorice. It's a special type of a licorice supplement, great for, and a natural solution for acid reflux. And then when it comes to bloating, to relieve that, one of my favorite solutions is carminative herbs, fennel, anise, caraway. These contain components that help us release trapped gas, although, that sounds unpleasant, but that's exactly what bloating is. And so those can be taken as teas, they can be taken in capsules, and it's just a really nice thing to have on hand in your natural medicine cabinet, especially as we go into the holidays, because it's not an easy time of year to try that 30-day wheat-free trial right now.
Right, January might be a better option for that. But I love the fennel, the suggestion for fennel. I know fennel was traditionally used as gripe water for infants that struggled with colic. So it's wonderful for soothing gas and bloating.
And you may have fennel seeds on hand in your, your spice.
In our spice section, we do.
Use some of those even.
Yeah, that's great. Or make a tea with it.
Yes, and also great for kids. I will do that. Kid has tummy upset, which is probably gas, I've either opened a capsule of carminative herbs or just had them chew up some fennel seeds.
Fabulous. Thank you. And you mentioned the holidays. With the holidays coming up, do you have any tips on how people can avoid overindulging? There's, going to be more social events this year now that some of the COVID restrictions have lifted. People are feeling a little bit more relaxed. So what can folks do to prevent some of that after post-meal, post-holiday bloat, maybe a little bit of weight gain, sluggish fatigue?
Yeah, so there's a couple of things. We know that these foods are part of the holidays, right? It's part of the tradition, things that we look forward to enjoying these feasts, and it's easy to overdo it. If loading up on fiber and fiber-rich foods either before you go to an event or at the event will help you feel full and satisfied without eating so much. That's one thing to consider, consuming more fiber-rich foods, and that also helps with regularity. And as well, in investing in or keeping on hand a good digestive enzyme a combination can really go a long way. What happens is we're eating often large amounts of foods as well as different combinations of foods we might not normally be having. And that taxes our body's digestive process. And what I mean by that is we're called upon, and specifically our pancreas, to make more enzymes. And sometimes it can't keep up with the challenge of a very large meal. And if we're not digesting those foods, they can feel heavy, bloated, sluggish, slow. And so a combination of supplemental digestive enzymes, which will be similar to the ones produced by the pancreas that help break down fats and starches and proteins, can just sort of give your digestive system a little hand in the job it has to do. So that can really make a difference in feeling well and digesting well when we're having especially large and complex meals.
Absolutely. I always keep those enzymes on hand for events like that. That's a great, and loading up on something high fiber beforehand, filling up a little bit, that's a great recommendation. That really helps. Something else that I sometimes suggest to people and that I practice myself too is when I go to a social event or a feast or a buffet, to choose one indulgence. So if I'm going to indulge in, say, alcohol, then I might pass on the dessert. Or if I'm going to have a dessert, then I might pass on the alcohol. It's worth it. It's worth it to feel good and to enjoy the event and to go home feeling comfortable and not feeling super tired and achy and bloated the next day.
Right, yeah, having that food hangover.
Exactly. Visit our website at naturalfoodpantry.ca. Be sure to subscribe to our newsletter, also on our website, and follow us on Facebook, Instagram, and YouTube. Thank you so much, everybody. Stay healthy and happy holidays.